Okie dokie. And we are live.
Officially.
Hey, good evening, everyone. It's been a while since I came onto your screens with Real Health Talk. And this evening, I am so privileged again to come onto your screens with another edition of the Real Health Talk. And this evening, we're talking about mental health. Your mental health matters to us. What is mental health? What constitutes mental health issues? How does it even come about? Is there a cure for mental health issues? And recently we heard about a very influential, nice, lovely husband, father, friend, brother, uncle who committed suicide. Was there any signs? Was anything overlooked? Was there something they could have done to prevent that from happening? Well, I am not an expert on that, but I have an expert with me this evening who is going to tell us all about mental health. But before I bring him to your screens, let me read a bit of his bio to you, and then you can now decide for yourself. We always bring you the best anyway. So he is by the name of Dr. Albert. If I get the surname wrong, please pardon me. Settle here. Is that right, Dr. Albert? Settle here.
Yeah.
You know what?
Yeah.
Let me bring him to your screens while we start this conversation. So that is Dr. Albert on your screen. So he's Dr. Albert. Settle here. He's a specialist psychiatrist, sorry, working currently with the psychiatry department of Kolebu Teaching Hospital. He's been there since 2013. That is, he was previously with the Accra Psychiatric Hospital and Pantang Hospital. So you see, he's more than equipped to tell us everything to do with the mind. Now he's a specialist for Accra Medical Center and the VRA Hospital in Akosombo. As an additional duty, he serves as a clinical tutor at the University of Ghana Medical School. His passion to impart and empower as many people as possible to with accurate mental health information and help everyone with mental health illness, as well as contribute massively to the global aim of destigmatization of mental health illness. Guys, without further ado, I've already brought him to your screens, but hey, there he is, Dr. Albert Sedo here. Thank you so much, sir, for sharing your evening with me.
Most
And
welcome.
guys, it's going to be interesting. So, you know what? Share this link, share with other friends, get them to come on board because you may never know what people are going through and what information you can share to save somebody's life. And so, this evening, we're talking all about mental health. And we say your mental health matters. Your mental health matters to us. That is why we're bringing this very informative live show to you. So, Dr. Albert, you're welcome to our screens this
Thank you
evening.
very much. Thank you.
All righty. So, guys, we're going to ask Dr. Albert, what is mental health? When we talk about mental health, what do we mean by saying mental health? The
All
floor is
right.
yours, sir.
Thank you very much for inviting me. Of course, a good evening to your audience. I'm honored and privileged to have been chosen to be the guest speaker for tonight. It's a great honor, and I don't take it lightly at all. Thank you very much. And that's a very good question. What is mental health? A lot of people have their own, definition of it. But what mental health actually is that mental health is a state of complete well-being where an individual is able to handle the day-to-day normal stresses of life, is
Hmm.
able to live in harmony with everyone else, and at the end of it all, contribute positively to the larger society. So that is, in summary, what mental health is: your ability to handle daily normal stresses of life, make good choices, live in harmony with everyone else as much as you can, and contribute positively to the larger society. So that, in summary, is what mental health is.
Wow. So this is like a layman's understanding of what mental health is.
Yes.
Now, how does mental health even come about? Are people born with disease or illness, or something contributes or something triggers them into the place where we say they have mental illness or mental issues? Or you know, you are an expert. Are people born with mental damage, or is it acquired as they grow up?
Okay, so this is where I would have to distinguish between some very confusing terms. So mental health is what we all desire, all right? There's
Okay.
no health without mental health, because the definition of health itself is a state of physical, mental, and social well-being. So the three have to be adequate for it to have health. So
Right.
you cannot be described as healthy without having mental health. Now,
Hmm.
what you're asking is mental illness,
Illness.
and
Right.
that is
Okay.
any condition that affects how you think, behave, or feel. Any
Hmm.
condition that affect how you any condition that affects negatively. So any condition that affects negatively how you think, feel, or behave, that is mental illness. All right. So your
Right.
question is, are people born with it? Now, mental illnesses or mental disorders, there is a genetic component, and then there is an environmental component as well. All right. So if there are people, if it in your family, if a relative, a sibling, parents has it, you also have a high risk of developing it. Does not necessarily mean you will develop it, but it means
Hmm.
your risk is higher compared to others. But also, there are environmental precipitants, and the environmental factors can precipitate the mental illness, and same environmental factors can perpetuate it and keep and promote it. So what I'm trying to say is you may have the predisposition, which is the genetic predisposition, the
Hmm.
genetic risk of developing the condition. But if you don't have the environmental precipitants, if something doesn't happen, you may not likely develop the condition. So somebody may be predisposed to developing, say, depression, anxiety, or any of the mental disorders until the person is predisposed to maybe stress, extremes of stress, or some emotional imbalance, some emotional dysregulation. The person may never manifest the symptoms. Some
Right.
people, until the person uses hard drugs, the
Hmm.
person may never manifest the condition, but they are genetically predisposed. Yeah.
Right. Okay. So just the first question that hit the screen was, is it hereditary? And I think you've actually answered it. Um,
Yes.
and so we just take it from there. So if you're not, if it is not hereditary, so let's say it doesn't run in your family, but there's still other factors environmentally that can bring about mental illness.
Mhm.
Okay.
Yes.
All right. Take us through.
Okay, so there are a lot of factors that can predispose an individual to developing mental disorders or mental illnesses. You understand? Number one is stress. Stress
Hmm.
is anything that your system is not able to handle. There are normal stresses of life, which we all go through, which is okay for us to live a normal life. But there are extremes of it where your system is not able to handle. It could be from work, it could be
Mm.
from family, it could be financial, it could be from any relationship you might be in. So, stress from multiple sources can precipitate or predispose you to developing mental illnesses. So, that is one of them. Use of hard drugs, which is on the rise these days, can also precipitate or predispose an individual to developing mental illnesses as well. Very, very, very important for people to know that are very, very important. So stress and stress kind of underline most of the mental illnesses. Stress in every form. It can be in broken romantic relationship, which is common. I know you get to hear a lot of that in your field. So broken romantic relationship becomes a stress to the individual because it was highly unexpected.
Expected.
When it
Mm.
happens like that, it tips the person over. The person is not able to handle that acute shock, that acute stress. So that is the acute form of stress. It could also be chronic stress, where the person is being exposed to it at the workplace on the daily, or at home on the daily. It could be from financial inadequacy, where the individual just almost always is not able to cater for the basic, requirements of life. So all these ones can predispose the person in addition to the drug. And there are other things in women. In women, the hormonal changes can predispose them to mental illnesses, where maybe just the normal cycle, somebody can have a condition we call premenstrual dysphoric disorder, where ideally you're just supposed to have some small changes in your mood and at that time, but some people have extremes of mood changes and physical symptoms. Some may even warrant admission during that period. And again, in women, pregnancy again has to do with the hormones. Pregnancy alone, the state of pregnancy can predispose you to having depression, psychosis, anxiety, and any form of mental illness. So these are some of the environmental things that can predispose an individual to developing mental illness.
Wow. So it means that your mind is actually a very, very fragile place, that if you don't take very good care of it, you can just flip over. Because if I'm super stressed at work and it can tip me off, or even hormonal changes can tip me off. And I think a few years ago there was this documentary on BBC. It says oh, baby psychosis and me, where women that have after birth, so they just, we call baby blues, but then those
Yeah.
ones are, you can deal with it, but this one is like proper psychotics after giving birth. And it was
Yes.
quite very educative, very interesting, so I'm glad you've even brought it up. Now recently, about less than a week ago, I'm sure, there was this gentleman in a Nigerian millionaire, I heard, who committed
Yeah.
suicide. Now, I know that particularly with men, they tend to like bottle up a lot of, you're just talking about stress, take up a lot of stress, don't want to open up, don't want their egos to be bruised, want to see as the alpha male, the masculine, the man of the house, the papa, and all that, whilst maybe going through something that can easily be resolved by speaking to someone like you or coming to you for an advice. And so
Yeah.
let's talk about some of these things that triggers people to go to the extreme of not being able to handle. I know you've given us a bit of um, examples of stress, depression, anxiety, and all those, but what will tip somebody off to the point of saying life is not worth living anymore, and
All
so I
right.
need
So
to end it?
So I also heard about that. I also read that on social media, Facebook specifically, and it came to a lot of people as a shock, but to me, not quite, because he's a multimillionaire. So everybody will ask, "What's your worry? You have all the money. Why would you do this?" You see,
Yeah.
it's because, like you rightly said, men, out of the wrongful socialization, we are not brought up to open up about our issues. More so for somebody who is known in society as okay, supposed to be okay, supposed not to have any problem, supposed to have like all sufficiency. You are forced not to ever look vulnerable before people. You may not even have people you can talk to because they may not believe you if you tell them you are worried about something. So the
Yeah.
wrongful socialization that is particularly about the boy child, males, makes us almost always internalize our worries, our problems, and challenges. So people don't open up. Now, when it continues like that, it can tip you into depression and
Mm.
severe depression. When you are in that state, somebody might ask, why would you want to take your life? This is what you need to know. And I have handled a lot of people who have attempted taking their life. And if you speak to them, you will get to understand that none of them actually wish to die, but just at that point, they didn't see or they couldn't see any way out of whatever challenge they were facing at
Hmm.
the point of attempting the suicide. They don't see any way out of the problems or the challenges they are facing. That is why they feel that is the only way out. Typical example is a young lady who attempted suicide by drinking some, taking some overdose of some medications. And then after seeing her and taking her through some therapies, when I asked her, why did you try taking your life? She said she's gone through whatever she was going through for about, I think, 15 years. So this is a chronic stress that she's been exposed to on the daily. And she's tried every way and means possible to get out of it. And she thinks at that point there was no way out. But guess what? When she shared her problems with me, there were multiple ways she could solve it.
Yeah.
But when you are in that state, you won't see any way out. You might think taking your life is the only way out. She's alive now. She's doing well. She's working and everything. So in men, especially, the wrong socialization makes us not want to open up or look vulnerable to other people. Now, when people tip into depression, which is one of the commonest underlying mental disorders that cause people to prefer to die by suicide, the symptoms are quite a lot. And if you have good friends who actually care about you and not just about what they will get from you, and most people who are well to do, they have a lot of people around them who are just there because of what they are going to get.
Yeah.
Not necessarily about you, which means that if all that they are getting from you is no more, they are going to leave you. You understand? So the symptoms are quite elaborate. Some of which are
what causes depression?
Okay, so let me handle that and I'll go to the symptoms, the signs and symptoms. So
yeah,
depression is a mental illness. It's a mental illness that has both genetic and environmental, risk factors. So it can run in the family, and there can be precipitated by environmental factors. Stress is one of them. Broken relationship is one of them. There are use of hard drugs can also make somebody go in suffer depression as well. So we will not say there's a particular cause, but there are risk factors. Pregnancy can predispose someone to developing that's postpartum depression.
Yeah.
Hard drugs, alcohol, marijuana, any of them can also cause somebody to develop depression. Failed marriage, loss of a job, any of these can also precipitate somebody. If it runs in your family, you could suffer from it as well. Have a chronic illness, medical condition. A chronic medical condition can predispose you to having depression. You have suffered a stroke, and whilst in the recovery period, you can suffer. You have a chronic medical condition like cancer, you can suffer a depression. So these are all risk factors. A cause means that when you have it, you're supposed to have it. But risk factors means it increases your chances of. That's how we say it. So the symptoms of depression, which is the commonest mental illness that is diagnosed globally, one, feeling sad, extremely sad. This is not a kind of sadness that you can just snap out of. No, it's extreme sadness. And then the person begins to lose interest in things that they used to love, they used to like. So in your case, if you are severely depressed, you like to have these live sessions and these programs, and you like to attend to your clients, you might not want to have anything to do with what you used to do. So feeling extremely sad, losing interest in things you used to like, crying without provocation, not sleeping well or overly sleeping, not eating well or overly eating. Yes, it could be extremes of it. Losing weight or gaining
weight.
Wow. You could also have a feeling of hopelessness, feeling of helplessness, feeling of worthlessness, and then suicidal ideation, that's suicidal thoughts, and or suicidal attempt. You also have poor concentration, and most people will be indecisive. So you have someone who don't know what to do. Everything he or she has to ask somebody for a second opinion before he or she is able to. That's indecisiveness. So these are some of the symptoms of depression, and it can come with psychotic symptoms as well when it is severe. We have mild, moderate, and severe. The mild ones, people are able to handle it themselves, and with the help of friends and family, they're able to come out of it. The moderate ones, it affects your work, your academic performance, your work, and your family life or your social life. The severe ones, you are not likely to be able to work. You're not likely to be able to relate well with other people. Well, that's where people tend to isolate and be in their room, will lock the door, will not eat, will not bath, will not come out, will not pick calls, phones are off, they don't want to go to work, nothing else matters to them. Those are the ones that likely wish to die by suicide. So that is depression. It's the commonest mental illness that is diagnosed in every mental health clinic where you know. So that is about depression. So this man that you're talking about most likely was going through something, but did not have people he could talk to, did not have people he could trust with certain information. You understand? That is most likely what happened. And if people are close to you who truly love you, not for what you are giving them, they will notice the changes. They will notice these days your energy level is low. These days you don't talk much as you used to. These days you are not as forthcoming as you used to. These days you are sounding a little off. These days you're not able to do things you used to do. The things you used to talk to us about, you're no more doing them. And you might even be complaining to them about your sleepless nights or your poor appetites. But you see, most of these people, when they tell people these things, people just say, oh, you'll be fine. You'll be fine, especially for men. For men, you're supposed to be strong. You're supposed to remain strong. You're supposed to be, the all in all. So you'll be fine. They just tell, oh, you'll be fine. No problem. You'll be fine. Just go on a vacation. You'll be fine. But it's not always about that. People need to talk to people. They need to voice out, open up to people. And the other challenge is about confidentiality. If you tell your story to somebody, you don't trust that they will not go tell another person about it. So people mostly prefer to handle issues on their own. So that is one of the challenges we are having. Yeah. And the male gender, we take on a lot, because we are supposed to be the head of the home, supposed to be the provider, supposed to be the protector, the shield, and everything. So we take on a lot of stress. Absolutely. Job, family, everything. We take on a lot. And most males take on a lot of risky behaviors. And most males, yes. Trauma. Yes, very, very true. Trauma also is a risk factor for mental illnesses. Trauma, especially head trauma and, physical trauma, emotional trauma. All these traumas can also predispose you to mental illnesses. So, and males have a higher chance of risky behaviors. So, higher risk of physical trauma and all the other ones. So, those are some of the, and most of the males also may become overly confident. So when they have a condition, they may feel they are okay. They may refuse to take medications or even treatment. So they may have equal numbers of both male and females that have a particular condition. More women will seek
help,
than males. So the male gender is at a higher risk, And when it comes to suicide, more women attempt suicide more than males, but more men end up dying by suicide more than females, because most of the males use more lethal means of attempting the suicide. So that the risk is higher with them than that of the female. So that is where we are. And the substance abuse is some way, somehow, even though we are now going 50-50, but it's some way, somehow higher in males. Yeah.
Some girls are dangerous,
Now it's more of a less 50-50. It's a level playing field now.
50-50. So we strike a balance there.
Yeah.
Wow.
Now we're striking a balance. That's some of the risk factors.
This is so interesting, and it's so informative. I mean, there's a lot that we didn't even know, but talking to you now, it's not bringing my mind to, we're talking about depression, to how, I mean, seeing a few of my girlfriends who they kind of like lose interest in the things that they used to love doing before. But now when maybe you call them out, girl, do you want to go out for Friday drink? They're like, nah, no, I'll sit this one out. I'll do a rain check. And you realize that it's become a pattern where before when you call them, hey girl, do you want to come out for Friday drink? Yeah, where would I meet you? What time? 7, right? I'll be there. And true, they just drive their cars and they're there. But now when you call them, they don't know. I'll do a rain check, and you might think, okay, they're trying to maybe cut down on. But now talking to you, it's bringing my mind that listen, these girls can actually be depressed and they might need help, and so it's necessary that we that we think we are okay need to reach out to these ones that we think that may need extra help, maybe just by talking to them and getting them to open up, and then asking them to seek for help will probably help a lot of these people. Now when we talk of clinical depression, what is that word? Because I hear people talking about, oh, clinical depression. So they are on antidepressants, they're on medication to help them sleep, medication to help them maybe suppress their appetite, or these things. So what is clinical depression?
Okay, so that's what I said earlier. So it's a
So that,
mental
oh,
illness that
right,
is characterized by low mood, where you feel extremely sad and you
okay,
begin to lose interest in
right.
things that you used to love and all the other symptoms that I mentioned. But one thing we all need to know generally, and this is what the only thing I want everybody to take home is this, that no one is immune to mental illness. No one. That
Wow.
is what everybody needs to know. No one is immune. Most often than not, it's just a matter of time and circumstances.
So
What I
something can
mean
just
by that
trigger
is,
you.
what I mean by that is the person that you know has a mental disorder today that you may be stigmatizing, something happened that precipitated his or her episode.
Hmm.
The person wasn't born like that. Now, if same thing happens to you, yours might be worse off. So when you now know that the difference between you and the one you are labeling as having a mental disorder is a matter of time, possibly a matter of time and circumstances, you will treat that person humanely with respect, dignity, and care and love.
Hmm.
So no one is immune to developing mental illness because you don't even know if you are genetically predisposed or not. Because
Yeah.
most people don't even know if there's anybody in the bloodline who has ever suffered a mental illness. So I
Hmm.
say boldly that almost every family, if you take first generation to 10th generation, there could be somebody now who is suffering one form of mental illness or the other, or somebody who may likely develop it soon. So no one is immune to, because you might be fine until you get a broken heart.
Yeah,
You lose
true.
your job. You might be
True.
fine until you get an accident. You might be fine until you get pregnant. So you get pregnant and then you have postpartum depression, postpartum psychosis, postpartum anxiety. You were okay, supposedly, until
Yeah.
pregnancy, the circumstance of pregnancy happened to you. You were okay until you lost your marriage. You were okay until you lost a loved one. So grieving can become pathological grieving, where you lost your father, your dad, a child, or a relative, a sibling, and then you you go through that process and having pathological grieving that tips into depression, anxiety, and even psychosis. So no one is immune. We are supposed to
Wow.
love, care for everyone that has it, not to stigmatize them, but to care for them. Very, very important for all
Wow.
of us to understand all
Wow.
this.
Wow. Well, I just put a question on for you. It says what causes psychosis, and I mean, just it's very interesting that you talked about grief, because I personally, I lost my dad over 23 years ago. But even though I'm way much older, on his birthday, on Father's Day, and then on the day he died, I don't want to talk to anybody. I want to be in my little corner. I want to just, and just sometimes, even listen, at my age now, I'm quite old, but sometimes I think of the things I used to do with him, or things he said to me, and even the way he looked at me, or the way he said to me, and then it pushes me back into grief, and I may sometimes cry, or not want to
Mhm.
talk to anybody, or just want to be alone. And so you're talking about grief. I realize that grief is very deep as well, that it can actually push you way onto the line or the borderline of depression if you don't have people around you that can actually lift you up or maybe seek for help. Wow. So
Yes.
guys, if you're grieving, please seek for help, speak out and get help. Now let's talk about.
You know,
Oh
so,
yeah, please go on.
so talking about grief, there are stages of grieving, about 7, modified from 5, it'd be modified to 7. Depression is one of them, one of the stages. All right. Now, when you are grieving, you must get stuck at a particular stage for longer than you should. Ideally, when you lose a loved one, we expect you between 3 to 6 months, you should be over. That's why friends come around, funeral is done, you see the person really that he or she is dead and he's been buried, and people come to, help you, all the support you need and all that. But there are people who are not able to just handle it well emotionally. And then they keep thinking about the person, they keep hearing the person's voice, they keep seeing the person, they keep thinking about the person, sometimes they even keep blaming themselves. Guilt feelings can even develop into guilt delusions, where the person begins to believe strongly that they caused the person's death. And something they could have done to, avert the situation and all these things. So it can become a pathological grieving where you need much more help. That is why anybody who is grieving, of course, you need to speak to a therapist where you are taking through grief counseling so that you can handle it better. So now the question is on the screen, which is, what causes psychosis? Again, in our field, we don't specifically stick out and say, this is what is going to cause it. It's what are the risk factors. What that means is, what are the things that increase your chances of developing this condition? So psychosis, the biggest of them is schizophrenia. What are the risk factors? Genetics is big on that. Genetics. If someone in your family, yes, genetics. Genetics is big on that. So if someone in your family has it, you have a higher risk. If the closer the person is to you, the higher. If the person is, say, your twin brother or sister, you have a higher chance. If the person is a brother or sister, higher chance. Person is a mother or father, higher chance. Auntie, if the person is a distant extended family, there is a high chance, but not as high as if the person is closer to you in the lineage. So genetics is big on that. Then environmental factors can precipitate you. Big on that is hard drugs. There are a lot of people that use marijuana that precipitates their psychosis. Pregnancy can precipitate your psychosis. Chronic stress can precipitate your psychosis. Acute stress can precipitate your psychosis. So you see, it's not about cause. When we say cause, it means that when you have these things, you're going to get about. No, you can have a twin brother who has schizophrenia and you may not develop schizophrenia. You just have a higher risk of developing it.
But so along the line, can maybe your child or can have it, even though you didn't have it, but your twin had it?
Yes.
Amazing.
Yes. So once it's in the bloodline, everybody in that bloodline is at risk. But it doesn't mean that you are all going to develop it.
Serious, man. Wow.
So when it happens like that, when you have this knowledge, what you should now focus more on is, how do I protect my mental health?
Amazing. Yes, that is so
because
true.
It's in the bloodline. It has nothing to do with you. You didn't cause it. You didn't give birth to yourself. You happen to be born in that bloodline. So your focus will now be on, how do I protect my mental health? And we're going to talk about that separately. For now, let me just handle the questions. How to protect your mental health? I'll handle that generally.
Okay.
So I'm just handling what causes psychosis, which is genetics and then environmental factors. Again, so if it's in the bloodline, you are at increased risk. Then the things that can precipitate it, hard drugs use, starting from marijuana, that's cannabis, methamphetamine, even alcohol. Yes, alcohol can do that. Alcohol.
Do you know what? I'm talking about alcohol. A lot of people don't even think that alcohol can actually harm you.
See, alcohol, and then we're going to talk about drug addiction. It's also a different thing altogether. Addiction itself is a brain disease, because some people are able to take alcohol socially, and they can choose not to take again the next time. But some people start and they don't seem to be able to stop. Why? It's because of genetics again. Addiction.
Talking of alcohol. Let's talking of alcohol.
Yes. So the risk factors are genetics and then the environment. So hard drugs use, chronic stress, acute stress, pregnancy can precipitate it.
Wow.
Trauma, any form of trauma can also precipitate it, especially if you are already genetically predisposed. So you see, now you cannot even be sure if you are genetically predisposed or not.
Yeah, because you don't know.
So yours is to focus on promoting your mental health.
Wow. Wow. See, I'm really enjoying it because a lot of people are saying it's very informative. Babatunde, thank you so much for joining us. And he says it's very nice to be very informative. Sika said the same thing. She says thank you, and she's learning a lot. So I mean, we have very positive feedback that people are actually enjoying it and learning a lot. And Araba says, "Oh, my wine." Yeah, it doesn't mean that when you take a glass or two, you're going to go. But you need to cut it out, please. We don't want that. Wow, this you know what you're just blowing my mind because I didn't even know that schizophrenia is actually like hereditary or it can come in your bloodline. I didn't know. I
Highly,
I
very highly, very
My
extremely highly.
goodness.
I know a lot of people that it's in the bloodline. You can have the mother, the father, the children, their grandkids. It's just running through like that.
Damn.
And if you are aware of it, it's a good thing because you can then prevent it or
Yeah.
know what to do. You know,
So
it's
how
those
do
who
you
don't
how do
even
you
know that there's
prevent
somebody in the
it?
family.
How
How do
do
you
you
prevent it?
Yes.
Good. So that will bring us to how do we promote our mental health? How to prevent mental disorders? You know, it's preventable because you see the fact that you are predisposed doesn't necessarily mean you're predisposed doesn't necessarily mean you're going to develop the condition. You know,
Yeah.
so best one of them is to be aware of what mental health is. A lot of people misconstrue mental health for mental illness.
Illness. Yeah.
When people hear mental health, all they think about is people who have mental illnesses. You understand? That's what
Before
they
people.
think. But mental health is the good
Yeah.
thing we all aspire to be.
Yeah.
Mental health is what
Absolutely.
we all want. That
Yeah.
is your ability to withstand the normal daily stresses of life, make good choices, and contribute. That's mental health. That's what we all aspire to. Mental illness is what we don't want. You understand? So your awareness of it alone is preventive in nature, which means that if you develop any of the early signs and symptoms, you will seek help early for us to
Yeah.
start treating.
True.
Sometimes you don't even need medication. You may just need one or two, you may just need therapies,
Yeah.
to help
True.
you through it. But if you're
True.
not even aware of something called depression or something called anxiety and you're having the symptoms, you might not know what to do. We've handled cases where the person has gone through the thing for like 10, 20, 15, 20, 30 years. And people around will confirm that, yeah, we've always known him to be like this. We've
Yeah.
always known him to be doing this thing, but we never knew it was a mental illness. So awareness is one of the ways to promote your mental health and to prevent mental. And another thing is rest. Good rest. Sleeping, sound sleeping. At least 6 to 8 hours of uninterrupted sleep. It puts your body
A lot
through.
of a lot of people don't do that these days, you know.
No, the world is a fast-moving thing now that a lot of people don't have the time to even rest.
No.
So good rest is preventive. Good rest, at least 6 to 8 hours of
Hey.
uninterrupted sleep. It's and avoiding hard drugs. Avoiding hard drugs. It's one of the ways you can. Yes, one of the ways you can. Social support is
All right.
very key.
Yeah.
Social
True.
support.
True.
Good
Yeah.
social support. Humans, we are social beings.
Yeah.
We cannot survive alone. We survive in groups. That is why
Absolutely.
you marry, then you give birth, and then it continues like that. We don't
Yeah.
survive. You are alone, you die, and that nobody will ever even remember you ever existed. So if your mom, dad didn't give birth to you, nobody will have ever even known they ever existed. You understand?
Yeah.
So we survive in groups. So good social support, friends who you can call on when you are in distress, when you
Yeah.
need something urgent to be done, you need some form of help, people you can talk to.
You are going through something, somebody you can talk to, somebody you can call, somebody you can also check on, good social support. And very important, financial security is preventive.
Yeah.
Financial security, because money answers all things.
All
Money,
things.
money is
Absolutely.
money is a tool, and you need
It
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 to do
is
a
a
lot of things.
tool.
And
It is a
it makes
tool.
life easy.
Money. Money answers all things. Guys, did you hear that? Do you know why
So,
I'm laughing? Because yesterday,
mhm,
one of my sons posted on
yeah,
on his Facebook. He says that when people says that money can't buy happiness is one of the most silliest quotes ever,
you
because
don't know
poverty doesn't buy you jack. Poverty.
exactly. I'm telling you.
Okay, so there's a question here from Tunde. He says, Doctor, how would you help someone who is stuck on smoking weed? Is there redemption for someone like that? Also,
Yes.
kindly break down the stage of help if possible.
Okay. Now, for someone who is addicted to marijuana, weed, there is help available. You know, Again, it's addiction and it's a brain disease and it's about the reward system. When you do something and you like it, you want to repeat it. And when you take these hard drugs, what it does, it mimics that feeling where it
Yeah.
makes you feel good. But the way it makes you feel good, it's higher than the normal way you are supposed to feel good.
Hmm.
So the natural things that you're supposed to get rewarded for are mostly food, sex, water, rest. Food, sex, water, rest. These things make you feel good, so you want to do them more and more.
More. Hmm.
So when you take these hard drugs, the chemical that is released naturally, it's now released in multiple folds, about 10 to 100 times. So this is what happens. So this causes some changes in your brain. The chemical is called dopamine. So this causes some changes in your brain. So you always want to chase that high feeling, that feeling of whatever you call it. You always want to chase it. And you keep chasing to the point where you prefer that high to every other thing in the world. So you neglect every other aspect of your life to that. It can affect your work, your relationship, your schooling, everything. You don't care because you're just chasing that. But the thing is, that high that you got in the initial stage, you will never be able to get it ever again. You'll just keep
Hmm.
chasing it and it will keep eluding you. You will never be able to get it. That's what gets the person to become dependent, because now you started taking to feel high, but now you want to keep taking just to feel okay, because you never
Hmm.
feel the high again. And it means that if you don't take it, you'll not feel okay now. Let's use alcohol. So you start drinking to feel somehow. It gets
Hmm.
to a point where without the alcohol, you can't function. Without the alcohol, you can't get out of bed. Without the alcohol, you can't do anything. But then the alcohol also affects your body from head to toe. So a
Yeah.
person stuck on weed, what the person has to do is to go to a hospital, an addiction unit. A hospital has a rehab program. All
Rehab.
right.
Hmm.
Go in there. You're going to take your history fully. And of course, you would have decided you want to stop. But
Yeah.
you've been trying, you're not able to because of the vicious cycle you are trapped in. So you go, there are medications they're going to give you, and there's a program you're going to go through to gradually help you with the behavioral modification. So there is help available. You have to go seek it, or someone has to seek it with you or on your
You.
behalf.
Hmm.
So there is help
Wow.
available.
Right. Tunde, I hope your question has been answered. Now, there's another one that says, is panic attack a mental illness?
Yes, it is. Now, almost all the mental illnesses I'm talking about, it's caused by chemical imbalances in our brain. How you feel is all mediated by chemicals in your brain. If you're feeling happy, it's because certain good feel hormones or chemicals are released. If you're feeling
Hmm.
sad, again, it's because of certain chemicals that are released. So these symptoms that you are going to be having is because of the imbalance in those chemicals in your brain. Panic attack is where a person suddenly feels on the edge, lightheaded, the heart is pounding, sweating, they feel like they are losing it, they have breathlessness, and their head is spinning for 3 to 5 minutes, 10 minutes, and then it subsides. That's panic attack. If it happens multiple times, then it becomes a panic disorder. And yes, it's a mental illness. What happens in that state is your system has gone through the stress response is left on, like the smoke detector in your kitchen. When it goes off, you know there's smoke somewhere.
Yeah.
But once the smoke is over, you're able to put it off.
Yeah.
But your system has been switched on to in a stress response for survival. Our human being is made for survival. Our brain especially is made for survival. So you are perpetually in that state of fear where you are afraid something bad is going to happen to you. So you're on the lookouts. So panic attack, yes, it's a mental illness. And there's help available. There are a lot of therapies that can help. There are medications that can also help as well.
Wow. Man, it means that we need to actually take very good care of our brains, take care of our minds, even what we think about, how we think about things, and all that can actually have an impact on our mental health. And so, what
Very
are
true
some,
what you said.
yeah,
Very true,
yeah,
because you actually feel what you think.
true.
If you think negative, you feel negative. If you think positive, you feel positive. So it has to be a conscious effort that you're going to focus on positivity more. And if you think more positive, more negative, you're going to feel negative, you're going to act negative. Same as if you associate with the wrong crowd, you will become part of the wrong crowd. So what you think on, thoughts are very, very powerful things. Thoughts lead to emotions, beliefs, emotions, and then your actions, your reaction. Then it goes all around like that again. So yes, we need to take good care of what we think on.
Right. Okay. So now let's talk about, we've talked about all this that is scaring me, all this psychosis and all that. Now, how do we actually maintain good mental health?
So it's very important we do so. You know, like I said, the first step is awareness. You need to know there's something like that, so that when you are having the symptoms or you see somebody having the symptoms, you can seek help or draw the person's attention to it quickly. Like you rightly said, you might have a friend that you almost always go out with in groups, and then you consecutively 3 or 4 times, when you call the person, nah, I'll take a rain check on that.
Yeah.
No, that is not the person's normal way of response to these kind of things. You understand? That's not the normal response.
Yeah.
But that's what the behavior now is. So you notice it. That is the person losing interest in the things that they would have done. So you've noticed it. Now, because you are aware it's a possible symptom of something, you know what to do because of awareness.
Yeah.
Do you understand? It's very important for awareness. It's very, 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 very important. Awareness is key. Resting, good resting, sleep. Like I said, sleeping for at least 6 to 8 hours is very key.
That is where the
Sleep for at
problem
least
is, because
8
a lot of
hours.
people don't sleep these days
Exactly. A lot of people do not have enough rest.
at
A lot of people
all.
just do not have it. So good rest, 6 to 8 hours of uninterrupted sleep, because the body wasn't made to be on 24/7.
Yeah.
Nope. You're supposed to sleep, allow your body to go through that period of rest where the files are put together into folders and stored in long-term memory, medium and short-term memory, so that when you wake up, you feel refreshed and you're able to do better. Now, you notice that people who don't sleep, they are not able to be at their best, at their optimum. No way. You cannot. There's no way you can be at your best. Sleep deprivation predisposes you to a lot of mental illnesses. And, you know, it's
Right.
also one of the cardinal symptoms of a lot of the mental disorders, sleep challenges as well. And I said social support. Human beings, social beings, as we are, you need people. You need people. So you cannot survive on your own. So you need to have people around you, friends, family, who gives you support, and you in turn give them support.
Yeah.
It's very, very, and of course, I said it earlier, financial security. And yes, financial security, we can't do it without.
It's important.
Extremely so. Then exercise and good diet. And good diet. The advice is at least 3 or 4 times in a week, you should do something very active, vigorous for 30 minutes plus every week. at least 3 times, and
Mm.
good diets. We all know what a good diet entails, just that most of us do not adhere to it. You
Mm-mm.
understand? So exercise, good diet, and avoiding hard drugs. Avoiding hard drugs, too much alcohol and hard drugs. If you do all of this, you are working towards, promoting your mental health and preventing mental illnesses. And very important, should you have a mental illness or mental disorder, seek early help, seek
Mhm.
early treatment, and remain compliant. That's one of the ways of promoting your mental health. Take early treatment and stay compliant, remain compliant on treatment and the therapies. Most of the conditions may not be curable, but once you're on medication, you should be fine. Now, this is what everybody has to get clear. It might sound confusing, but that is what it is. You can have a mental illness or a mental disorder and still have good mental health.
Okay.
Now, I'll let that sink in for 2 seconds.
Please.
What I
Yes.
mean is, you can have schizophrenia and still have good mental health. What I mean by that is, if you have schizophrenia or you have depression or you have anxiety and you are on treatment, the right treatment, and you are not having any symptoms, you are asymptomatic, you're on treatment, you don't have symptoms, and you are functioning okay in your society, there's no problem. That is good mental health. So even though you are diagnosed and you have schizophrenia or depression or anxiety or any of the condition, PTSD or whatever, you still have good mental health because you're on treatment, you are compliant, and you are functioning optimally. So there's no problem. So there's no difference between you and any other person. You can do everything. You are not limited in any way. What matters is you seeking help, seeking treatment, and staying compliant.
Wow.
That's what
Okay.
matters most.
There's a few questions here. I don't know why they're not popping up on the screen. One says, "Do narcissists have mental illness?" And then the second one is, I heard high blood pressure, diabetes, and consistent stressful lifestyle puts one at risk of getting dementia. What's your take?"
Okay, so let me take the first two questions. You're asking if narcissists have mental illness. Now,
Mm-hmm.
there's something called narcissistic personality disorder.
Disorder, yeah.
That is a mental disorder. It is. But you see, you have to be assessed by a professional and diagnosed. And then what many people may call narcissism may not necessarily be it. It's easy to accuse somebody of something when maybe you actually are the one doing those things. So you might think somebody has a problem, let the person go for professional assessment and
So it's
help.
important, yeah.
Yes, narcissistic personality disorder is a mental illness, true. But if you're not a professional, please don't diagnose, don't label anyone as such. Just to fit your narrative of
Yeah.
bad character, he's a narcissist, she's a
Mhm.
narcissist. Don't do that. Seek professional assessment and treatment. Now, somebody is asking, high blood pressure, diabetes predispose you to dementia. Very true. How? Poorly controlled hypertension, poorly controlled diabetes predispose you to the type of dementia we call vascular dementia. What that means is, if you have high blood pressure, if you have diabetes, all you need to do is have it well controlled. Take your medications, go for regular review. That is what you need. And again, hypertension, diabetes, genetic. It runs in families. So if your mother, dad, or whoever in your family has it, you also are at an increased risk of developing hypertension, diabetes. So what do? Prevent it. By exercise, good dieting. If you have been diagnosed, seek early treatment, remain compliant. So you see, these things are common. Whether it is mental illness or physical illness, these things are quite common for any chronic medical condition.
Wow. So guys, this evening, I think we're all been blown away. I didn't even know that high blood pressure, diabetes, and stressful lifestyle can even tip you off into dementia. I had no idea until this evening. And I didn't even know as well that schizophrenia can actually run in a family. I had no idea. I thought when one person has it, that's it. But actually, it can run through a family. So please, even before you get married, make sure there's no psychosis running through the family. You don't want it. Guys, it's we have 5 more minutes. If you have any questions, could you please I don't know why it's not popping on my screen, but at least I can see them here on Facebook, which is okay. So if you have any questions, we have 5 minutes. You can just drop them off before we say a very big thank you to Dr. Albert for spending an hour of his evening with us. We're so grateful. Okay, there's a question here. This is in my inbox. It says, "Is sex addiction a mental illness?" This one is in my
Yes, it
inbox.
is. It's what we call behavioral addiction. It's the same as drug addiction. The changes in your brain is the same. So the person has sex, more of it, just to feel a certain way. And most often than not, most of those people who become addicted, they might have gone through some traumatic past. You know, it could be some traumatic past, sexual abuse, physical abuse, emotional abuse, some form of abuse in the past that might tip them to become sex addicted. And most people who have behavioral addiction also almost always have drug addiction in addition. So it's the same. We have behavioral addiction and drug addiction. Most often than not, it coexist. You know, so sex addiction, yes, it is.
Okay. So please,
And
if
it
you
might have
if
a
you
lot of
have
other
that,
comorbidities as well.
if you have all these conditions, please seek medical help. We don't
Yes.
want to now have some trauma causes addiction. Yeah, we just had as well. Those of you who just see the question, we're just running up and the questions are now popping in. It says, "Can narcissism be cured?"
You see, this is the issue here. A lot of people who are not professionals label people wrongly. So I said, yeah, that's the thing. You think somebody has an issue, get help for the person. That's what matters most. You understand? Get help for the person rather than labeling the person to fit your narrative. You might actually be the cause of the problems.
Yeah.
You see, we all have blind spots. You might also be doing something that the person may be reacting to. And one thing you need to know is you don't have control over what people do. You only have control over how you react to what they do.
Exactly. That's
So
so
let's
true.
stop expecting people to behave in certain ways that we want. Do what you can. Locus of control. Do what you can. And let people be. If they have problems, seek help for them. Don't
Absolutely.
label them so that you feel good. That's you becoming judgmental. You becoming Mr. or Mrs. Righteous. No. You might have your own issues too. So
Yeah.
don't label somebody as a narcissist or whatever. No. What
You need to
about
seek
you?
for
You
help.
could be actually the one with the narcissism. You may not even know, and you are labeling everybody else as so and so. No. So you seek help for the person or for yourself. Don't label somebody as anything.
Yeah,
No.
but can it be cured? From
There are
what
treatments.
the little knowledge I know that you can't cure a narcissist, but you know how to. No, so you are the specialist now. Please take us through. Is it
So it's a
possible?
personality disorder. You know, it's
Personality disorder.
pervasive. And the personality is formed by 80 years going. It's formed, and there are therapies that a person can be taken through. And if you have a partner, there are coping mechanisms, healthy coping mechanisms that you will be taught. You understand? And the person may not even be aware they are doing some things, just as any condition. Somebody may be depressed and may not even know they are depressed. Somebody may have psychosis and may not know they are psychotic, but they have poor insight. So when you go and professionally you get assessed, then whatever is required, whatever is necessary, will be given you. Schizophrenia is not curable. Same as hypertension or diabetes or asthma. These are also not curable.
Yeah.
But they are managed.
Yeah.
You know. So yes, it may not be curable, but what matters most is there is help available. There is help available. And let's not think that we are better off than another person, because none of us is immune to any of the mental illnesses I'm talking about or I've talked about. So the issue of I want to be sure there's no psychosis in the family before I go in there. How about your family? How about your family? Your family may also have 2 or 3 people, but you've just not been told. What matters most is if the person has the condition or knows somebody who has it in his or her family, it's good knowledge. So the person now knows how to handle him or herself. There is no need to stigmatize such a person. So you are with a young lady or a young guy, and he's a good person for you. You are okay to go on with the person, to marry the person. And then you hear his brother has schizophrenia, so you are backing off. Okay, you've backed off. 5 years later, you hear your uncle has schizophrenia too. So will you go around telling everybody, please don't come to me, or have somebody in my family who has schizophrenia? No. So let's not stigmatize people living with mental illnesses. Why? Because none of us is immune from it. None of us. That is the only message I want to pass on. None of us
is immune.
None of us. It could just be a matter of time and circumstance. So let's treat them with love and care.
Right. There's another question here. I know we said an hour and we just hit an hour. There's another question here that says, what about ADHD? Is it curable, sir?
No, it's not curable. It's a neurodevelopmental condition that happens at in childhood because of the changes in the brain and during formative years and all that. So it's not curable, but there are ways to handle it. There are medications that are given to control the symptoms, therapies to help. So it's not curable. No, that's why so again, you have to know what the symptoms of ADHD are. When you know it, you seek help immediately for your child, and then if medications are indicated, the child is given, therapies are initiated, and sometimes, if not almost all the times, the caregivers, they need a lot of therapies themselves.
Absolutely. I was going to say that. Yeah, that's so true.
There's something called caregiver burden, where the person taking care of the person who has the condition is going through a lot of stress. And that alone can tip you into something, to depression or anxiety. So that person also needs some form of therapy, continuous, as they care for the individual who has the condition. So caregiver burden is a real thing. All right. Yeah.
Ah, wow. Fantastic. Now, before we round up, I had a client that said to me that she's on borderline split personality.
Okay.
Borderline. She's been diagnosed with borderline split personality. Now, just 5 minutes, talk us through what this kind of personality disorders are, please.
So what you're talking about is borderline personality disorder. Okay, this is where it's most common in females. All right.
Yes.
So borderline personality is where the individual feels chronically empty. Has a lot of relationship problems, and they have high risk of self-harm, deliberate self-harm. They have a lot of relationship problems, almost always feels chronically empty, and they have a lot of deliberate self-harm attempts. These individuals have emotional dysregulation. That's borderline personality. So these are some of the symptoms of borderline personality disorder. There is another one, which is narcissistic personality disorder, where the individual seems to be selfish in all he or she does. Everything is about him or her. Everything is just about him or her. It's centered around him or her. Then there is antisocial personality disorder, where the individual goes against the norms and the rules and regulations of society, and they kind of hurt other people and for their own gains. So they mostly end up as criminals, and most of them end up in jail or they die from the things that they do. That's antisocial personality disorder as well. There's histrionic, which is kind of attention seeking, where the individual wants people to just talk about him or her, want to always look flamboyant, colorful, dress all over the place, and almost attention. Want everybody to think.
Attention seeking.
That's histrionic kind of personality disorder. So those are the ones that, yes, the common ones that are personality disorders. Yeah.
Guys, it's been amazing this evening. It's been awesome. And I'm sure we need to bring Dr. Albert back again, because we need a part 2 of this. This is just like the tip of the iceberg. There is more to mental health and mental illness that we have no idea of. And I'm sure we're all taking something home with us this evening. If you're watching us live, that's fine. If not, please, if you just share this link to your friends, to your families, let them learn. Share it on your timelines, share it on your various platforms. Let's gain knowledge, let's learn. It's important. You just don't want to wake up one day and hear that a friend of yours is depressed, is got anxiety, is committed suicide, when if this information was given to the person, they would have sought for help, or even you yourself would have offered help to the person or help for yourself. And we just shared earlier that if you have a friend who suddenly doesn't want to go out, doesn't want to dress up, doesn't want to do stuff, you would know that they're falling into depression and you can be of help to them. And so, please, this is very important to me. Share it on your timelines, share it onto your various platforms. Let people glean knowledge. This is free. You're not paying me. You're not paying me. I'm not paying Dr. Albert. He's giving me a whole hour of his time. And if we were supposed to pay him, I don't think we would get the money enough to pay him for an hour. So, guys, say thank you to Dr. Albert for me. And I'm so grateful to take you away from your family this evening. And I'll say thank you. But I'm sure this is just the beginning, because we need to bring you back again. There is more we need to gain from you with regards to our mental health. And
Most
so,
welcome.
on that note, I want to say a very big thank you to you, Dr. Albert, and I want to say a very big thank you to all our viewers for staying with me for a whole hour. I'm so grateful. And as usual, I'm going to come your way again very soon with another episode of the Real Health Talk, where we talk about real health issues that are hurting real people. The Lord bless you and keep you. The Lord make his face shine upon you and be gracious unto you. Go through this week with the confidence and assurance that greater is he that is in you than he that is in the world. I love you and have a good evening. Bye bye.